Okay, in this video we're going to look at types of ECG. ECG types primarily differ by activity level. The standard resting ECG, lying down, stress exercise ECG, treadmill, bike, and ambulatory ECGs, wearable for longer periods like Holter monitors or event monitors for intermittent issues, plus specialized implantable loop recorders for long-term monitoring, all revealing heart electrical activity to diagnose rhythm problems or issues under strain. Common types of ECG: resting ECG. Okay. Exercise ECG, ambulatory ECG. Cardiac, cardiac event recorder. How they differ. Types of electrocardiogram. Okay. Approach. What we offer you for EKG. Electrocardiogram. Before, during, after EKG trackings. So here we have EKG trackings. We have QRS complex. The next short upward segment is called ST segment. ST segment indicates the amount of time from the end of the contraction of the ventricles to the beginning of the rest period before the ventricles begin to contract for the next beat. The next upward curve is called the T wave. The T wave indicates the resting period of the ventricles. When the doctor views an EKG, he/she studies the size and length of each part of the EKG. Variations in size and length of different parts of the tracing may be significant. Types of EKG. Interpretation. So here we can see a chart where we have the P wave elevated, atrial depolarization, and also here delay at AV node, here PR segment, ventricular depolarization, ventricular repolarization, no electrical activity. Here we can see on the images, this is ecgwaves.com, which is a whole website dedicated to studying the EKG. EKG interpretation newsletter and get a free ECG pocket guide. Okay. Download. See, so here we have the P wave, PR interval, QRS duration. This is the QRS complex. We have J60 point, which this is the ST segment. From this S right here to T right here, ST segment. And then we have TP interval from T here to P here, which is the start of a new contraction. Rhythm, P wave and PI interval, QRS complex, QST segment, T wave, QTC interval, the cardiac conduction system, waves, intervals, and durations on the ECG. The walls of the left ventricle and the LEDs that view these walls. ECG LEDs. The placement of ECG LEDs. Ground electrodes. P wave changes. Abnormal P waves. Mitral valve. Pulmonal valve. ST segment depressions. So this is physiological, and here we have non-specific depression, which is like this one here. And then we have characteristics, horizontal and downsloping. Real life example. positive T wave, inverted T wave, short segment, ST segment. Here we have left bundle branch block, left ventricular hypertrophy because it doesn't go up as much, right bundle branch block, pre-excitation delta wave, right ventricular hypertrophy, large R waves, and ST segment depressions. ST segment elevations, concave T wave changes, normal, and this is hyperkalemia, hyperacute T wave, biphasic negative T wave, post-ischemic, acute ischemia, cerebrovascular insult, hypertrophic cardiomyopathy, perimyocardite, electrical axis of the heart, prorhythmic ECG changes during sinus rhythm, notch, slur, hypertrophic cardiomyopathy, digoxin, okay, right atrial abnormality, left atrial abnormality, assessment of RP interval for tachyarrhythmias, diagnosis and management of tachyarrhythmias, hypertrophy and dilatation, right ventricular hypertrophy, classification of acute coronary syndromes, NSTE, ST, ACS. This is the most common you find. Criteria for acute myocardial infarction, ST-ACS, STEMI, ST elevation, acute myocardial infarction, and non-ST elevation, acute myocardial infarction. Here we can see more of this. Black Week. Okay. Register. Here we have accounts, my courses. You can see basic anatomy, cardiovascular medicine, clinical ECG interpretation, echocardiography, ECG tests, exam in evidence-based cardiology, pacemakers and cardiac devices, pediatric and neonatal ECG interpretation. And then here we have systematic approach, rhythm, T waves, QRS, QTC, R progress. Okay. See, make this more clear because even after reading this much, it probably doesn't seem as easy to understand. Elementary quick tips. The visual nurse. Okay, 8 steps to basic ECG rhythm. QRST, heart rate, small box method, big box method, regular ventricular response, irregular ventricular response. So here they are identical, and here they don't show up regular like in a rhythm. Here we have sinus rhythm, wandering, atrial pacemaker, atrial fibrillation. ST segments, And that's it.